Hello. In this presentation, I will be speaking about leadership and management. I will define the roles of each, give some similarities, provide guidance in becoming a nursing leader or manager, and give tips on how to improve both leadership and management skills. Leadership and management are key roles in the profession of nursing. It is important to recognize the differences and similarities between these roles, and once those differences and similarities are defined, one can work on ways to improve both leadership and management skills. Management is the process of leading and directing an organization to meet goals through the use of appropriate resources. Managers tend to give more direction and they have subordinates, they're more authoritative. They often like to take the most efficient route to do things and aren't really there in the day to day. They're more about the big picture. Leadership, on the other hand, is the act of influencing and motivating a group of people to achieve a common goal. Leaders tend to ask questions and they have followers rather than subordinates. They're more motivational and they like to show you how to do things rather than telling you what to do and when to do it. Leaders like to lead by example, while managers just tend to give orders. However, the common goal is to have success at the end of the day. Stephen R. Covey was an American businessman and educator, and I really like the way he summarizes the difference between leadership and management. He stated that management is efficiency in climbing the ladder of success. Leadership determines whether the ladder is leaning against the right wall. In other words, management is more about getting things done, while leadership is more about getting them done in the right way. Now that we've gotten a general overview of the words leadership and management, let's look at the ways that these words apply more towards the nursing profession. When thinking about your career goals in nursing, this might include more of an advanced position, such as nurse management or nursing leadership. Knowing more about leadership and management can help you decide which path is right for you. Now let's look at the differences between nursing management and nursing leadership roles. A nurse manager is someone who has decision making powers and control over certain processes in an organization. While the role might not be direct patient care like the role of a bedside nurse, they are still responsible for the long term planning of patient care by directing staff, teaming up with an overall healthcare team, which includes the physicians and others, and coordinating a patient's continuum of care. Nurse managers have various roles. Amongst these, the most important are managing small or large teams of nurses, overseeing or coordinating the training of staff, supervising nurses' patient care, and collaborating with other managers to offer a range of healthcare services. A nurse manager primarily focuses on keeping daily operations in the department running as efficiently as possible. These managers usually don't handle patient care in a direct way. Instead, they supervise nurses and other staff members and provide training as needed. Nurse managers might also be responsible for creating a budget for the department, hiring staff members, ensuring electronic records are up to date, and interacting with shareholders. A nurse manager might also need to work with other managers in the facility and step in when difficult situations occur between healthcare professionals and their patients. Their responsibilities also include overseeing healthcare insurance issues. A nurse leader often has a clinical specialty of some kind. They focus on patient quality of care and safety, but at a higher level, leading teams of managers and RNs. In addition to leading clinical teams, these leaders advocate for the patients. Some nurses, however, demonstrate leadership at any level within organization and at any stage of their career. They might not have supervisory or management duties, but they help direct groups in ways that make them function better. Nurse leaders have various roles as well. Amongst these, the most important include acting as the strategic lead for patient care initiatives, directing a group of nurse managers, influencing others through effective communication and interpersonal skills. Now, this one is a big one for leaders because they tend to really connect with other people and influence them into performing better. They also implement evidence based practices and roll them out to other nurses and healthcare staff. Using evidence based practice is very important because it ensures safe and effective nursing care. They also mentor other nurses, which is a key role of being a leader. A nurse leader focuses on making sure individual patients receive quality care. As a nursing leader, the responsibilities include overseeing a nursing team and working on improving patient care. Nursing leaders are often expected to make patient care more efficient to help reduce hospital stays, lower the risk of readmissions, and reduce healthcare costs. Other responsibilities of a nurse leader include lowering turnover rates among nurses at the facility, providing patients with education to help them manage medical conditions better, and helping them understand their treatment plans to improve outcomes. Nursing leaders might also provide healthcare services directly in addition to educating patients. Although nurse managers and nurse leaders have different roles, it is important to note that they have the same goal in mind, which is to improve patient care. Now let's explore more of the similarities between nurse leaders and nurse managers. Nursing leaders and managers share some similarities, mainly in terms of the kinds of skills that are required for both positions. Whether you work as a nursing leader or a manager, you'll need to develop solid leadership and management skills. To succeed in either one of these positions, you'll need to be able to communicate effectively with others. You also need to work on your critical thinking and problem solving skills to make informed decisions. Both roles can also involve delegating tasks to others on a regular basis. Nursing leaders and nursing managers both play important roles in ensuring high quality patient health care. While leaders focus on making sure patients are receiving the care they need or finding ways to improve day to day procedures, managers concentrate on the bigger picture. Both roles are needed for facilities to continue providing great healthcare services. Becoming a nurse leader involves becoming a registered nurse first. After passing the NCLEX and receiving your licensure, your next step may include earning a graduate degree from an accredited program. While working on the graduate degree, you can expect to gain clinical experience that help you turn classroom learning into the practical skills that you'll need on the job. From there, you'll need to become certified if you plan to work as a nurse leader. You can do this through a certification program, such as the Clinical Nurse Leader Certification Program ordered by the American Association of Colleges of Nursing. After completing these steps, you'll be able to begin working as a nurse leader. In order to become a nursing manager, you need a minimum of a BSN degree. You will also need years of bedside experience because you will be overseeing other nurses in this role. Many healthcare facilities will want at least 5 years of experience to become a nursing manager. It is also critical to advance your nursing education because it is becoming more common for nurse managers to hold advanced degrees. Nurse managers are advised to take master's level classes that focus in advanced nursing practice as well as ethics and policy. Some programs include a practice where students must apply their knowledge in different administration situations. Other classes will include organizational management, leadership, and human and fiscal resource management. Another certification option for nurse managers is taking a certification exam to become a certified nurse manager and leader. The Association of Critical Care Nurses offers this certification in conjunction with the American Organization of Nurse Executives. In order to be eligible to take the certification exam for nursing manager, one must have a bachelor degree or higher in nursing, 2 years of experience as a nurse manager or a non nursing bachelor degree, and 3 years of experience in a nurse manager role, or an associate's degree or nursing diploma and 5 years of experience as a nurse manager. Experience should be a minimum of 1,040 hours for all scenarios. Now, let's look at the benefits of having an exemplary leadership and management in the nursing field. A huge benefit of having good leadership and management in nursing is that it brings individual nurses together as a team. Without nurse leaders and managers, individual nurses would carry on with their jobs independently and would likely miss key opportunities for communication, growth, and education. By bringing the treatment team together, nurse leaders and managers verify that each nurse is obeying the same high standards of quality and safety. Another benefit of having good leadership and management in the nursing field is that standards are maintained and quality and safety of healthcare is optimized. Having a great leader and a great manager causes a domino effect in which employees under the manager and the leader perform at a higher level. Another benefit of proper leadership and management in the field of nursing is that it causes an increase in advocacy. Leaders and managers can use their authority and skills to advocate for higher quality care for patients. Now let's look at ways that we can improve leadership and management skills as individuals. A good way of developing your leadership and management skills is by practicing discipline. A good leader or manager needs discipline. People will judge your capacity to lead by the amount of discipline you display at work. A good way to start is by doing small things, such as waking up early, getting your daily exercise in, and just doing small things little by little to develop your discipline. A great way to develop leadership and management skills is to take on more responsibility. One doesn't have to take on more than they can handle, but it is important to do more and more, regardless of what it is. It could be at work, it could be at school, but the key is to do more. Another great way to improve leadership and management skills is to learn to follow. A true leader or manager has no problem yielding control to another person when appropriate, of course. One shouldn't feel threatened when someone disagrees with you, questions your thinking, or puts forth ideas of their own. It's good to keep an open mind and give merit where merit is due. Another way to improve leadership and management skills is to learn how to inspire others. A leader should be able to motivate and inspire those who work with them so that they can collaborate as best as they can. When a team member needs encouragement and guidance, it is important as a leader or manager to offer it. Sometimes all a person needs is to listen and be sympathetic. Another fantastic way to become a better leader and manager is to keep learning. The best path to becoming a good leader is to always keep learning new things. It keeps the mind sharp and the skills fresh. So it is always important to continue your education. Don't stop at the BSN, go on to the masters, and so on and so forth. That will ensure that your leadership and management skills are fine tuned. Another great strategy to develop your leadership and management skills is to develop situational awareness. What I mean by situational awareness is that one can see the bigger picture and anticipate problems before they occur. This is a valuable skill to have when handling complex situations. The ability to foresee and provide suggestions for avoiding potential problems is invaluable for a leader or manager. One final way to develop better leadership and management skills is to be assertive when necessary. People tend to respond well to authoritative figures who also know when to be kind. Ultimately, a leader or manager needs to be balanced. It is not good to be too authoritative, but it's also not good to be too much of a friend. Therefore, it is important to find that sweet spot right in the middle. I hope that this presentation has magnified the importance of leadership and management as it pertains not only to the field of nursing, but to life in general. Thank you.